The next and last presenter for this session is Dr. Agnes Langat from Center for Disease Control and Prevention in Kenya, and she's presenting the abstract number 11, Factors Associated with Late Presentation of HIV-Infected Infants for Early Infant HIV Diagnosis Service in Kenya.
Greetings to all of you. My name is Dr. Agnes Langat, and I will be presenting on factors associated with late presentation of HIV-infected infants for early infant HIV diagnosis services in Kenya. Progress to decrease infant HIV infections have stalled, and yet the scale-up of early infant diagnosis (EID) is one of the main priorities for countries aiming to achieve elimination of mother-to-child transmission globally. Some of the countries under the global plan only achieved around 50% testing coverage among the exposed infants in 2016, and by 2018, coverage had only increased to 68%, as shown on the second bar graph. Kenya is among the 21 priority high HIV burden countries targeted to ensure global epidemic control. We have an estimated 69,000 HIV-infected women in need of ART, whereby our current MCT rate is at 10.8%, and this is still very high. But despite efforts to scale up EID, only 69% of the HIV-exposed infants born in Kenya by 2019 received HIV testing within the first 8 weeks of life. Our annual target is about 80%, so we're way below that. Recent studies in Kenya still show that in some areas, 51% of HAEs received their HAEs services at some point in their life, but a quarter still failed to receive their first test before the 8 weeks of age, and this is contrary to the Kenyan guidelines. We therefore set to try and understand, to assess the factors that are associated with late enrollment into HAEs services for the HIV-infected infants in sites that are supported by PEPFAR. This was a cross-sectional study that was done between October 2016 and September 2018. We collected data from routine clinical documents like PCR log registers, the HAE-exposed infant registers or cards, the antenatal registers for the mothers and their clinical cards or any maternal medical records. We looked for the association of baseline characteristics to timing of HAE enrollment using logistic regression. The definitions that we used: late HAE enrollment was defined as any PCR testing done after 8 weeks of age from the time of birth. Maternal ART start date, and we used as a proxy for time of maternal HIV diagnosis, since we did not have the actual HIV diagnosis in the records. And for the mothers who were diagnosed for the first time in MCH, they were referred to as newly diagnosed HIV patients. And for those who had had a test prior to this birth, they were referred to as known HIV status. So, looking at the results, who are the infants who are more likely to test HIV positive? Of the 4,011 HIV-infected infants who had the date of birth recorded, we found that 67% of them enrolled late for EID services after 8 weeks of age. The median infant age at diagnosis was around 13 weeks, with a very wide interquartile range of 4 weeks to 64 weeks. This just showed that they had late access to PMTCT or HAE services. Looking at the mothers, who are the mothers who are likely to be transmitting HIV? First, looking at among all the infants, the 4,000 infants, 60% of the HIV-positive infants were born to newly HIV positive mothers, newly diagnosed mothers. Secondly, we looked at the mothers of the HIV-positive infants who enrolled late, and this were the 2,669 infants, and we found that 51% of them were born to young women aged between 24 and 34 years. 46.7% did not attend ANC. 64.5% were newly diagnosed HIV-positive mothers, and 60.5% were initiated ART at postnatal period. Looking at our multivariate analysis, what we found were the factors that were independently associated with late enrollment were lack of maternal ANC, new maternal HIV diagnosis, lack of maternal ART with adjusted odds ratios of 1.54, 1.38, and 1.96 respectively. However, hair identification in the outpatient had an adjusted odds ratio of 14.2 and 8.92 in the inpatient. This outpatient or inpatient, this is where the infants were presenting for the first time or they were being captured for testing, having either been missed in the MCH clinics or were presenting for the first time in the outpatient because of seeking other medical services. In conclusion, therefore, what we are saying is that, first, a HIV-infected infant means that there's something in the PMTCT cascade of care that we have missed, a missed opportunity. 2, we need to identify the HIV positive mothers early by advocating for early ANC services for the moms and therefore, and hence early EID services for the infants. 3, routine HIV screening in OPD and inpatient setups will help to identify the infected infants who may have been missed in the MCH clinics or presenting for the first time. I would like to acknowledge the Ministry of Health staff at the PMTCT facilities and the PEPFAR implementing partners who are supporting these facilities. Thank you for listening.